Hello, I am Dr. Sahib Goda Shetty, consultant plastic surgeon at Dr. Shetty's Cosmetic Center, Rajajinagar, Bangalore. With advancing age, there is volume loss, including bone, muscle, fat, skin. That means they all thin out. So, they become less resistant to the pressures. So, whenever the muscle acts, the skin wrinkles. Initially, to start with, they will have dynamic wrinkles. So, the plump look goes, and because of the volume loss, there will be sagging of the skin. The skin, because of the gravity, gets pulled down. So the target here is to lift the tissues up. So whatever tissues have come down, they have to be removed or replaced. So wherever there is a volume loss, suppose in the upper areas, so like malar areas, so our temporal area, we have to add the tissue. So we can add fillers, fat, okay, or else we can pull the tissues which have come down because of gravity. And usually they need some replacement, and we have to thicken that area. So mainly the skin which is visible. So there are surgical and non-surgical treatments. In non-surgical treatment, we can use fillers, Botox, and then like fat injection. So there are other treatments like high intensity focused ultrasound, which remove the bulgy areas, which whatever the tissues, fat or muscle which has come down, that can be reduced with high intensity focused ultrasound. That is, the ultrasound energy is focused at certain depth, either it is 3 millimeter, 4 millimeter or so that it shrinks. And sometimes the fibrosis in that area pushes some tissue upwards. So there can be some lift naturally, and then like we can induce some neocollagen formation, and the skin thickens and it becomes resistant to the further forces on the skin because of the underlying muscle. So that is called as microneedling radiofrequency. We use Morpheus 8, which is like more advanced, and it causes less post-inflammatory hyperpigmentation. In microneedling radiofrequency, the needles go inside and hit the skin up. Whenever there is an injury, like there are chances that the skin becomes dark. So in this case, the skin becomes less dark or no dark, that is almost no post-inflammatory hyperpigmentation, that is almost no darkness in the skin. So even if there is some any darkness, we can reduce them with further de-tanning creams. And then the facelift is surgical. In surgical, like we cut the extra skin. If the skin is too lax, then we remove excess skin and fix it. Then just in front of the ear, we take a small cut and then adjust the tissues below the skin, and we mold the face to a youthful look. Whatever the skin has sagged down, that is pulled up and placed there and maintained, and the skin over it is draped, so that face has got a better contour. So in this case, just not just the mid face or neck is lifted, like we address the area below the eye and the forehead. Forehead skin is also removed, and the scar is well hidden in the hairline.